Before beginning the sterile dressing change, I would review my orders. I would then obtain all my supplies. I would go to my patient's room, introduce myself, wash my hands. I would then identify the patient using the wristband and verbally. I would assess the patient, answer any questions, explain the procedure. I would check for allergies. I would then provide privacy for the patient by asking the family and friends to leave, check for adequate lighting. I would do my assessment, and then I would raise the bed for proper body mechanics, and then I would perform the proper hygiene. When changing the old dressing, you would start by putting on your personal protective equipment. And then put on my non-sterile gloves. Okay. And then I would assess the patient, make sure the patient was in a comfortable position, and make sure that the wound was easy to access. Before I put my gloves on, I would have washed my hands. And then I'll make sure there's a waterproof pad on each side of the patient. And then I have my biohazard bag garbage close by. I'm going to take the old tape off, making sure to hold the skin. And if it sticks, I would soak it with saline, normal solution. So yeah, so this is sticky, then I'll soak it. And then I would assess the amount of drainage and the type. And I'll take the other pads off, once again assessing for the type of drainage, amount, color, and if there's any odor to it. If there was, I would have taken the Sharpie and I would have circled the amount of drainage and initialed that. And then I will open up my 4x4s and soak them with saline. remove my gloves and then wash my hands and then don my non-sterile gloves again. I would then proceed to clean the wound. And I would make sure that I'm assessing the wound and the sutures and making sure to count each one. And then I would make sure to, again, assess the color, amount, odor, and size. And then one more time over. Okay. When obtaining a culture, I'll take my culture tube, remove the swab, and I would swab the area, making sure to completely get it. And then I will take the swab, put it in the tube. I would then label my tube appropriately, and I would place it in the biohazard bag with the orders. Orders in the back, and then I would take this to lab. After finishing my biohazard bag to the lab, I would remove my gloves and I would wash my hands. Then to apply the dry dressing, I would open my gauze pads, two 4x4 and one abdominal. And I would open and apply my sterile gloves. And with this glove, I would have made sure only to touch this portion of the glove. And then I would take my gauze pads and apply them over the wound. Take my abdominal pad and apply that over the wound. I would then secure with tape. And then to care for the drainage device, I would unpin from the patient's gown, and I would open the drainage device and pour it into a measuring device. and pour into the measuring device. I would then measure, and then I would dispose of as necessary. Put the drainage into the cup. I am going to take my alcohol swab and I'm going to cleanse the port. And then I will deflate that. I will then repin to the gown, and I will then remove my gloves and wash my hands. And then I will return the patient to a comfortable position. I will raise the bed, put the table in reach, and put the call button in reach for the patient, ask if the patient is comfortable, and I would then go document and